Your heart is beating right now. It's been beating since before you were born, and it will keep beating until the day you die. Roughly 100,000 times every single day. This fist-sized muscle pumps blood through 60,000 miles of blood vessels, delivering oxygen and nutrients to every cell in your body. But here's what most people don't realize. Your heart doesn't send you warning signals when something starts going wrong. It doesn't ache when plaque begins building up in your arteries. It doesn't beep when your blood vessels start stiffening. And it certainly doesn't flash a warning light when inflammation begins damaging the walls of your coronary arteries. Heart disease kills more people in the developed world than any other condition, more than all cancers combined. And the terrifying part is that for half of all people who die from heart disease, the first symptom they ever experience is sudden death. No chest pain beforehand, no warning, just cardiac arrest. The reason this happens is that we've been looking for the wrong signs. We've been taught to watch for chest pain, shortness of breath, or arm numbness. And while those are certainly serious symptoms that require immediate medical attention, they're late-stage warning signs. By the time you're experiencing those symptoms, you've already got significant disease. What we need to understand is that heart disease doesn't start the day you have a heart attack. It starts decades before. And your body is constantly sending signals that something is wrong. You just need to know what to look for. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AANDE, I've seen what happens when heart disease goes undetected until it's too late. My goal now is to help people recognize the early warning signs so they can prevent heart attacks and strokes before they happen, not manage them afterward. For the next few minutes, we're going to talk about 7 surprising signs that you're already at risk for heart disease. These aren't the classic symptoms you've heard about. These are subtle indicators that your cardiovascular system is under stress right now, even if you feel perfectly healthy. And the reason we need to understand these signs is that catching heart disease early before symptoms appear is the only way to actually reverse it. Once you've had a heart attack or stroke, we can prevent another one, but we can't undo the damage that's already been done. So let's talk about what your body is trying to tell you. The first sign is erectile dysfunction, specifically in men under the age of 50. Now, this might seem completely unrelated to heart health, but it's actually one of the earliest and most reliable predictors of cardiovascular disease. And the reason is surprisingly straightforward. Erectile function requires healthy blood flow. When a man becomes aroused, the arteries in the penis need to dilate rapidly and fill with blood. This process requires functioning endothelium, which is the thin layer of cells lining all your blood vessels that produces nitric oxide to keep vessels relaxed and open. When those endothelial cells are damaged by inflammation, high blood sugar, or oxidative stress, nitric oxide production falls, and when nitric oxide falls, blood vessels can't dilate properly anymore. Now here's the critical part. The arteries in the penis are much smaller than the coronary arteries feeding your heart. They're about 1 to 2 millimeters in diameter, compared to 3 to 4 millimeters for the coronary arteries. That means endothelial dysfunction shows up in the penis first, typically 3 to 5 years before it causes problems in the heart. So erectile dysfunction isn't just a quality of life issue. It's a canary in the coal mine. It's your body telling you that your vascular system is breaking down at the cellular level. And if it's happening in the small vessels of the penis, it's happening in the coronary arteries too. You just can't feel it yet. Multiple studies have confirmed this connection. Men with erectile dysfunction who have no other symptoms of heart disease are at significantly higher risk of heart attack and stroke within the next 5 to 10 years compared to men without ED. And the younger you are when it starts, the more concerning it is. If you're a 45-year-old man experiencing erectile dysfunction and you don't have an obvious cause like diabetes or a medication side effect, you need to get your cardiovascular risk assessed immediately. Not in 6 months, not when you find time. Now, because that symptom is telling you that something is damaging your blood vessels systemically, and heart disease is almost certainly developing even if you have no chest pain or shortness of breath. The second sign is receding gums or chronic dental disease. And this is one that shocks people because they think dental health and heart health are completely separate. They're not. Your mouth is filled with bacteria, hundreds of species living on your teeth, gums and tongue. In a healthy state, your immune system keeps these bacteria under control. But when your gums become inflamed, which we call periodontitis, the barrier between your gums and your bloodstream breaks down. That allows oral bacteria to enter your circulation. And once bacteria get into your bloodstream, they don't just disappear, they travel, and one of the places they end up is the walls of your arteries. When bacteria lodge in arterial walls, your immune system responds with inflammation to try and clear the infection. That inflammatory response damages the endothelium and accelerates plaque buildup. It's essentially like pouring gasoline on a fire that's already burning. What we've learned from decades of research is that people with severe periodontal disease have a 20 to 30% higher risk of heart attack and stroke compared to people with healthy gums. And the association is independent of other risk factors like smoking, diabetes, or high blood pressure. Even if you control for all those variables, the dental disease still predicts cardiovascular events. Now, the mechanism here isn't just about bacteria. Chronic gum inflammation also raises systemic inflammatory markers like C-reactive protein and interleukin-6. These are molecules that circulate throughout your body and contribute to vascular damage everywhere, not just in your mouth. So when your gums are bleeding, swollen, or receding, what's really happening is that you've got a chronic low-grade infection that's driving inflammation throughout your entire cardiovascular system. And that inflammation is one of the primary drivers of atherosclerosis, which is the plaque buildup that eventually causes heart attacks. If you've been told by your dentist that you have gum disease, or if you notice your gums bleeding when you brush or floss, don't brush it off as just a dental issue. Get your cardiovascular risk factors checked, because that infection in your mouth is very likely affecting your heart. The third sign is a diagonal crease across your earlobe, and this is called Frank's sign, named after the doctor who first described it in 1973. It's a diagonal line that runs from the bottom of your ear canal down to the lower edge of your earlobe, usually at a 45-degree angle. And yes, it sounds bizarre. How could a wrinkle on your earlobe possibly indicate heart disease? But the research on this is surprisingly consistent. The proposed mechanism is that the earlobe crease reflects vascular aging. Your earlobe is one of the few parts of your body that has a rich blood supply, but very little structural support. It's mostly soft tissue and small blood vessels. When those vessels lose elasticity and blood flow decreases due to atherosclerosis, the tissue loses volume and structure, which creates that diagonal crease. It's essentially a visible marker of what's happening inside your coronary arteries. Multiple studies, including some with thousands of participants, have found that people with Frank's sign are significantly more likely to have coronary artery disease, even after controlling for age, smoking, diabetes, and other risk factors. One study found that the presence of a bilateral earlobe crease, meaning it appears on both ears, was associated with a higher burden of coronary plaque on CT angiography. Another study found that people with the crease were more likely to have heart attacks and die from cardiovascular causes over a 10-year period. Now, this doesn't mean that everyone with an earlobe crease will have a heart attack, and not everyone with heart disease will develop the crease. It's not a perfect predictor, but if you have it, especially if you have it on both ears, it's worth paying attention to. It's a sign that your vascular system may be aging faster than it should be. Okay, if you're watching this video, you're clearly someone who cares about your health and wants to prevent disease before it happens, and I just want to take a moment here to ask for your help. I promise to keep creating the most useful, science-backed content I can to help you live a longer, healthier life, and avoid the diseases I see in the emergency department every single day. And all I ask in return is that you give this channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time or you haven't learned something valuable, then feel free to unsubscribe. No hard feelings. But if you give me your time and attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit that subscribe button to help this content reach more people like you. And let's continue with the remaining 4 signs. The fourth sign is chronic loud snoring, especially if it's accompanied by pauses in breathing during sleep. This is called obstructive sleep apnea, and it's one of the most underdiagnosed risk factors for heart disease. Here's what happens. When you have sleep apnea, your airway collapses repeatedly during the night, sometimes hundreds of times. Each time it collapses, your oxygen level drops and your brain sends out a panic signal to wake you up, just enough to start breathing again. You might not even remember waking up, but it happens over and over all night long. Every time your oxygen drops, it triggers a massive surge of adrenaline and cortisol. Your heart rate spikes, your blood pressure shoots up, and your blood vessels constrict to try and preserve oxygen delivery to vital organs. This is the fight or flight response being activated dozens or even hundreds of times every single night. Over months and years, this creates sustained damage. The repeated oxygen drops generate oxidative stress and inflammation. The surges in blood pressure damage the arterial walls. And the chronic elevation of stress hormones keeps your sympathetic nervous system in overdrive, which raises your baseline blood pressure even during the day when you're awake. Multiple studies have shown that untreated sleep apnea dramatically increases the risk of hypertension, heart attack, stroke, and arrhythmias like atrial fibrillation. And the more severe the apnea, meaning the more times per hour you stop breathing, the higher the risk. One study found that people with severe sleep apnea were 3 times more likely to die from cardiovascular causes compared to people without it. The tricky part is that most people with sleep apnea don't know they have it. They just think they're bad sleepers, or they attribute the daytime fatigue to stress or getting older. But if your partner tells you that you snore loudly and they've noticed you stop breathing during sleep, or if you wake up gasping for air, or if you're constantly tired despite getting 7 or 8 hours in bed, you need to get tested. Sleep apnea is treatable. CPAP therapy, which keeps your airway open during sleep, dramatically reduces cardiovascular risk. But you can't treat it if you don't know you have it. The 5th sign is persistent unexplained fatigue that doesn't improve with rest, and this is especially important for women because fatigue is one of the most common early symptoms of heart disease in women, even though it's rarely talked about. Men typically present with classic chest pain when they're having a heart attack. Women, on the other hand, often experience what we call atypical symptoms. Overwhelming tiredness, shortness of breath, with minimal exertion, nausea, back pain, or just a general feeling that something isn't right. The problem is that these symptoms are vague and easily dismissed as stress, anxiety, or just being busy. But what's actually happening is that your heart isn't pumping efficiently anymore. When the coronary arteries are narrowed by plaque, the heart muscle doesn't get enough oxygen, especially during physical or emotional stress. This reduces cardiac output, which means less oxygenated blood is reaching your muscles and brain. That manifests as fatigue, not the kind of tiredness you feel after a long day, but the kind where simple tasks like walking up a flight of stairs or carrying groceries leaves you feeling completely drained. Multiple studies have found that women who go on to have heart attacks often report unusual fatigue in the weeks or months beforehand. One study found that 70% of women who had heart attacks experienced unusual fatigue in the month before the event, and many of them didn't have chest pain at all. So if you're a woman and you're feeling persistently exhausted in a way that's different from normal tiredness, and you can't explain it with poor sleep or overwork, don't ignore it, especially if it's accompanied by other symptoms like shortness of breath, dizziness, or a feeling of pressure in your chest or upper back. That's your body telling you that your heart is under stress. Get it checked. Don't wait for it to get worse. The 6th sign is small yellowish deposits on or around your eyelids. These are called xanthelasma, and they're made of cholesterol. They usually appear as soft, flat, yellowish bumps near the inner corner of your upper or lower eyelid. And while they're not painful and they don't affect your vision, they're a visible sign of lipid dysregulation, which means your body isn't processing cholesterol properly. Xanthelasma occurs when cholesterol builds up in the skin. And the reason it shows up around the eyes is because that skin is very thin, so deposits become visible more easily. But if cholesterol is accumulating in your skin, it's also accumulating in your arteries. Studies have consistently shown that people with xanthelasma have higher rates of heart attack and ischemic heart disease compared to people without them. One Danish study that followed nearly 13,000 people for over 30 years found that those with xanthelasma had a 50% higher risk of heart attack and were more likely to die from heart disease, even after adjusting for other risk factors like smoking, diabetes, and family history. Now, it's important to note that xanthelasma can occur in people with normal cholesterol levels, though it's more common in those with elevated LDL or low HDL. The deposits themselves are benign, they're not dangerous, but they're a marker that something is off with your lipid metabolism. If you notice yellowish bumps around your eyelids, don't panic, but do get a full lipid panel done. Check your LDL, HDL, triglycerides, and ideally get an advanced test that measures particle number and size, not just total cholesterol, because those deposits are telling you that cholesterol isn't being cleared from your system properly, and that's a strong indicator of cardiovascular risk. The seventh and final sign is cold feet or toes that turn white or blue, especially in one foot more than the other. This is called peripheral arterial disease, or PA, and it means the arteries in your legs and feet are narrowing due to plaque buildup. When blood flow to your feet is reduced, they don't get enough oxygen and nutrients. That causes several symptoms. Your feet might feel cold all the time, even in warm weather. The skin might look pale or bluish. You might develop slow-healing wounds or sores on your feet or toes. And you might experience cramping or pain in your legs when you walk, which goes away when you rest. That's called claudication. The reason this matters for heart health is that atherosclerosis is a systemic disease. If you have plaque buildup in the arteries of your legs, you almost certainly have it in your coronary arteries and carotid arteries as well. PAD is a red flag that your entire vascular system is under attack. Studies show that people with PAD have a dramatically higher risk of heart attack and stroke. In fact, the mortality rate for people with PAD is comparable to people who've already had a heart attack. It's that serious, and yet it's massively underdiagnosed. Many people dismiss cold feet as just poor circulation or getting older. But if you have persistent coldness in one foot, or if you notice colour changes in your toes, or if you get leg cramps when walking that improve with rest, you need to get an ankle brachial index test done. It's a simple, non-invasive test that compares the blood pressure in your ankles to the blood pressure in your arms. If there's a significant difference, it means you have arterial blockages. And if you have PAD, you need aggressive cardiovascular risk management, because your risk of heart attack and stroke is extremely high. Now, if you look at all 7 of these signs together, you'll notice a common pattern. Erectile dysfunction is caused by endothelial damage and reduced nitric oxide. Gum disease drives systemic inflammation. The earlobe crease reflects vascular aging. Sleep apnea creates oxidative stress and chronic blood pressure surges. Fatigue indicates reduced cardiac output. Xanthelasma shows lipid dysregulation. And cold feet mean arterial blockages. Every single one of these signs points to the same underlying process: chronic inflammation and endothelial dysfunction. This is what drives heart disease, not high cholesterol alone, not high blood pressure alone, but a system-wide inflammatory state that damages the lining of your blood vessels, impairs their ability to relax and dilate, and allows plaque to build up over time. And here's the critical point. All of these signs appear years before you have a heart attack. They're early warning signals that your cardiovascular system is breaking down. And the reason that matters is that heart disease is reversible in the early stages. If you catch it when all you have is endothelial dysfunction and mild inflammation, you can actually restore normal vascular function through lifestyle changes. You can improve nitric oxide production through exercise. You can reduce inflammation by eliminating processed foods and seed oils. You can restore insulin sensitivity through time-restricted eating and lowering refined carbohydrate intake. You can improve sleep quality and reduce stress hormones. But if you wait until you're having chest pain or shortness of breath, you're dealing with advanced disease. At that point, medication and sometimes surgery are necessary to prevent imminent death. But you can't reverse the damage that's already occurred. You can't unclog arteries that are 70 or 80% blocked. You can only try to stabilize the plaque and prevent it from rupturing. So what do you do if you recognize any of these signs in yourself? The first step is to get properly assessed. That means a full cardiovascular workup, including blood pressure measurement, lipid panel, fasting glucose and insulin, inflammatory markers like hsCRP, and possibly advanced testing like a coronary calcium score if you're over 40 or have significant risk factors. But testing is only the first step. The real work is addressing the root causes, and here's what the evidence actually shows. Works. Physical activity, particularly aerobic exercise, is one of the most powerful interventions for cardiovascular health. It improves endothelial function by increasing nitric oxide production. It reduces inflammation, it improves insulin sensitivity, and it lowers blood pressure and resting heart rate. You don't need to run marathons. 30 to 45 minutes of moderate intensity exercise most days of the week is enough to significantly reduce cardiovascular risk. Diet is equally important, and the evidence here is overwhelming. Diets based on whole foods, minimally processed ingredients, high in vegetables, fiber, and healthy fats from sources like fish, nuts, and olive oil consistently show cardiovascular benefit. What you need to avoid is processed food. The combination of refined carbohydrates, seed oils, and added sugars creates the perfect metabolic storm for inflammation, insulin resistance, and vascular damage. Sleep quality matters more than most people realize. 7 to 8 hours of deep, uninterrupted sleep allows your cardiovascular system to recover. It lowers stress hormones, it reduces blood pressure, and if you have sleep apnea, treating it with CPAP or other interventions dramatically lowers cardiovascular risk. Stress management is also critical. Chronic psychological stress keeps your sympathetic nervous system activated, which raises blood pressure, increases inflammation, and accelerates atherosclerosis. Practices like meditation, deep breathing, or even just regular time in nature have been shown to reduce cardiovascular events. And finally, if you smoke, stop. There's no safe level of smoking for cardiovascular health. Every cigarette damages your endothelium and accelerates plaque formation. So here's what I want you to take away from this. Heart disease doesn't start the day you have a heart attack. It starts decades before with subtle damage to your blood vessels that your body tries to warn you about through these surprising signs. Erectile dysfunction, gum disease, earlobe creases, sleep apnea, unexplained fatigue, xanthelasma, and cold feet are not random, unrelated problems. They're all manifestations of the same underlying process: inflammation, endothelial dysfunction, and atherosclerosis. And the reason you need to pay attention to these signs is that they give you a window of opportunity, a chance to reverse the disease before it becomes irreversible. In emergency medicine, I see the end result of ignored warning signs every single day. Patients who had all these symptoms for years but dismissed them as just getting older or being tired or not important enough to worry about. And then one day they have a massive heart attack or stroke, and suddenly everything changes. Don't let that be you. If you recognize any of these 7 signs in yourself, take them seriously. Get assessed by a doctor who understands cardiovascular risk. Get the appropriate testing done, and most importantly, address the root causes through lifestyle changes that actually reverse endothelial dysfunction and reduce inflammation. Your heart is the most important muscle in your body. It's been working for you every second of every day since before you were born. Give it what it needs to keep working for decades to come. And finally, if you found this video helpful and you learned something new today, please take a second to hit that subscribe button and share this with someone you care about. Because heart disease is preventable, but only if people know what signs to look for. Help me spread this message to more people who need to hear it. Thanks for watching, and I'll see you in the next video.